was trained as a social worker originally, and I'm a very practical person, and spent many years of my professional career listening to people who didn't have enough money to pay for their care, the real life examples of people who didn't have it. So I'd like the people here who represent organizations to give us a little idea of what they are hearing from people now. Where are the largest disparities? Where are the biggest problems? You alluded to it a little bit, but if we could just get some specifics on kind of what the landscape is today and what people's problems are.
We absolutely do. Our in-person programs, which serve more than 70,000 lymphoma and CLL patients annually, provide a meaningful opportunity for us to hear from the patients and the challenges they face. And I think one of the biggest lifts we hear about continually year after year is the need for additional patient education. Not only about their disease, so that includes the etiology, diagnosis, and treatment options that they and their loved ones can consider as they think about the treatment paradigm, but also about the healthcare system as a whole. I think we often focus on disease education, which is critically important and part of the Lymphoma Research Foundation's mission. But I think increasingly over the last several years, and I think the debate around the Affordable Care Act has provided an opportunity for both healthcare system and financial literacy for patients and for caregivers. I think that's become an important part of the dialogue and certainly something that we've taken into consideration when we're asking patients, policymakers, regulators to have this conversation to ensure that we're all well educated about all of these topics. I think is an important piece of the dialogue. And I think also to ensure that the patients themselves, who unfortunately aren't always invited to the conversation, to ensure that they are equipped with the tools and education they need to make informed decisions.
We have a information resource center at the Leukemia and Lymphoma Society, and we receive about 60,000 calls per year. And of those 60,000 calls, more than 70% of them are about cost. So, you know, we see a shift. We see a shift in cost sharing to the patient. And I was glad to hear that with Kaiser that your out-of-pocket costs haven't been overwhelming. The data suggests that especially in some of the healthcare exchanges, we're seeing extremely high co-insurance instead of co-pays. So 20, 30, 40, 50% of a drug cost. We're seeing high deductibles, high premiums, and it's clearly a burden for patients. We also see the use of the specialty tiers that Bob referenced earlier, and these specialty tiers are specifically targeted at innovative yet expensive therapies. If a patient is asked to pay 30 to 50% of the cost of that therapy, again, it is a reason why adherence could be really poor. And then a lot of these leading academic centers are not in these networks. And it's for a reason, because if you do it in our perverse system of reimbursement, if you do a good job treating somebody, everybody goes there. And if it's a restaurant, you want people to go in. Insurance companies, the plans now are designed for healthy people, and they redline sick people at the back end with these tiers and these high out-of-pocket costs. And I think that has to change.
Information is so important, right? And yet we hear over and over again that patients aren't fully prepared to have conversations with their doctors about their treatment decisions. They're not able to, to plan in advance about what some of these costs are going to be. And also, we can say that those who are at highest, I think those who are the ones who are at highest risk for sort of financial toxicity and poor outcomes and poor adherence are not those who just have financial burden, but those who also have high distress. So I think another piece that's really important to weave into the equation is, are we providing enough psychosocial support to patients? Are we asking questions? Are we preparing them? Because people are overwhelmed. It's not enough just to hand someone a piece of information. You have to make sure that they're processing it and that they can use it, that they're activated in a way that they can talk to their doctor, their healthcare team about it.
What about the, I'm sorry, I just want to know about the caregivers are, again, from my own experience, you take off of work. You have to, are you hearing from the, and I don't mean to down, because I want to know what other patients are saying about the caregiver part of things.
sometimes you can't even separate the patient from the caregiver, depending on the situation. I think that there are tremendous impact. We see, caregivers are often the ones who are carrying the burden of multiple roles now put upon them, having to manage the finances of the household and all the other duties and take care of their patient. I mean, it is really falling on the whole system.
And with the Affordable Care Act, the expansion of Medicaid, the young adults, we brought about 20 million new people into the healthcare system. So when you talk about, financial literacy, health insurance literacy, many people who, forgetting the stress and the trauma of having a diagnosis of cancer, don't have experience in negotiating these systems, which makes it even more difficult with the kinds of prohibitive costs that they're experiencing, how you even begin to approach that and to deal with it.